Welcome to the Southern Arizona VA Healthcare System.
We are excited to tell
you about our
amazing residency programs.
The Southern Arizona VA is an integrated healthcare system with over 250 beds and multiple primary care and specialty clinics right on the main campus in Tucson, Arizona. We also have several community outpatient clinics located in Tucson's outlying areas. The PGY1 residency program was first accredited in 1984 and accepts 8 residents. The PGY2 oncology residency program was accredited in 2010 and accepts 1 PGY2 resident. Both programs are based on the main campus in Tucson, Arizona. Our PGY1 residency program offers experiences in acute care medicine, primary care, critical care, pharmacy operations, and 3 electives during the year, such as mental health, infectious disease, academia, oncology, geriatrics, and even informatics. The PGY1 residency longitudinal experiential activities include a longitudinal primary care clinic, which is half a day per week, an anticoagulation clinic, weekend staffing, as well as a variety of administrative experiences. The PGY2 Oncology Pharmacy Residency offers experiences in outpatient oncology, surgical oncology, inpatient oncology, bone marrow transplant, hospice, and palliative care, in addition to the therapeutic drug monitoring, drug information, and drug policy development for the hematology and oncology clinic. The PGY2 Oncology Residency offers 2 electives during the year, such as hematology, academia, and residents may even repeat an experience in any area of interest.
Hi, I'm Stephanie Davis, the PGY1 Residency Director at the Southern Arizona VA Healthcare System in Tucson, Arizona. Our program was accredited in 1984, and since that time we've grown from 1 residency position to 8. Each year, our residents provide feedback about the program, and they consistently list our preceptors as one of the many strengths we have here. We have over 50 preceptors to help guide you through the program. As the newest member of the pharmacy team, each resident brings with them their unique experiences, strengths, perspectives, and goals. We learn from each other throughout the residency program, and we work collaboratively to provide the optimal care to the veterans that have served our country. Our program's goal is to build and strengthen core skills in communication, clinical, and confidence, equipping the resident to be able to practice in any setting upon completion of the residency program. We tailor the program to each resident to meet their goals. Some ways that we tailor the program include 3 electives, having the resident complete 1 or 2 of those electives before the mid-year program, so that way they can decide if they want to pursue a PGY2 program or not, to select their continuity clinic, either at the main station of the VA or at one of the community-based outpatient clinics, selecting a residency project in their area of interest, and selecting topics that they present to the pharmacy staff, as well as their continuing education presentation. Our program offers a blend of both the ambulatory care and acute care experiences. A few of these experiences are repeated twice. This provides the opportunity for the resident to see their growth in their clinical skills, confidence, as well as independence. As a residency director, I feel a real joy in watching the transformation of each new graduate to a confident pharmacist by the end of the program. If you join our group here, you'll be joining 7 co-residents, an amazing group of preceptors and pharmacy staff as the first step in your career. I thank you for your interest in our program at the Southern Arizona VA Healthcare System. If you have any questions, feel free to reach out to me or one of our current residents. Thank you.
Hi, my name's Megan Banashinsky, and I am the PGY2 Oncology Residency Pharmacy Director here at the Southern Arizona VA Healthcare System in Tucson, Arizona. We have been an accredited ASHP program since 2010, and we accept 1 PGY2 oncology pharmacy resident each year. During this residency, you will receive specialty training to ensure optimal drug therapy for oncology patients. You will provide care in a variety of settings, including outpatient oncology, inpatient and acute care, surgical oncology, bone marrow transplant, as well as palliative and hospice care. We work closely with oncology providers, including attendings and fellows, as well as nursing, social workers, and dietitians to provide patient-centered care for our veterans. We are a huge resource for patients and caregivers when we provide drug counseling at the chairside, as well as supportive care treatment options for patients. This program is tailored to meet the goals and development plan for each individual PGY2 resident. We are able to customize rotations and are flexible with changing things depending on the resident's interests. There are plenty of teaching and learning opportunities for the resident, including precepting and mentoring pharmacy students, the PGY1 residents, as well as oncology fellows in their training for the 3 years that they're with us here at the VA. Your RPD serves as your primary mentor, but you'll also have a lot of precepting and mentoring from other pharmacists across the healthcare institution. You'll have the opportunity to work with 8 PGY1 residents here at this healthcare setting, and we, as preceptors, are dedicated to the professional growth and development of our PGY2 oncology resident. Please feel free to reach out to me if you have any questions or concerns about the program, and we appreciate your interest in our PGY2 program here at the Southern Arizona VA Healthcare System. Why did you choose this residency?
I was actually fortunate enough to have 2 of my 4th-year pharmacy school rotations here at the Southern Arizona VA, and I absolutely fell in love with this residency program. The pharmacists here are so integrated into the care teams, both inpatient and outpatient, and truly empowered to practice at the top of their license. The preceptors are also amazing. Most of them completed their residency here, and so they know exactly what we're going through and are always so eager to help. Finally, I love that we have such a large residency class. I get to learn from my co-residents every single day, so it's great.
I chose this residency program because when I was here as a student for my API rotations, I felt that my preceptors were really engaged, they were passionate at what they do, and they were really invested in my learning. After pharmacy school, I knew I wanted to continue to serve veterans and go to a residency that offer electives in my interests, which is psych and infectious disease. So I felt that my great experience here and overall my goals aligned well with this residency program is ultimately the reasons why I chose to do my residency here.
I chose this pharmacy residency program because of the wide variety of experiences that it offers, and with these I knew that I would be prepared for any type of work afterwards. And especially after I met the preceptors at my interview, I knew that the preceptors would fully invest in training me to become one of their colleagues. And a few months into residency, they still hold me to these high standards and help me grow professionally.
What are you enjoying the most about residency so far?
There's a couple of things I'm enjoying a lot about this residency. One of them is how flexible they are. There's 3 electives that are set up throughout the year. If you have an interest in one of the electives and they don't have one currently, then they allow you to create one. So one of my interests is transgender health, and we don't currently have an elective, but the program director and other pharmacists are helping me to create this elective, and so, because I'm interested in it. Another thing I really appreciate about this residency is work-life balance. So I feel like they maximize my time here, but at the same time they allow me time outside to recharge, so while I'm here I get the most out of my residency experience.
What I've enjoyed most about residency so far is seeing how integrated pharmacy is within both the inpatient and outpatient settings. When helping my primary care patients, it's really fulfilling to have consistent communication with them and be able to make any medication changes that are needed on the spot due to the progressive scope of practice we have at the VA. And I've also really loved rounding with the internal medicine teaching teams and infectious disease consult service. Interprofessional collaboration is truly what optimizes patient care, and I'm really grateful that this residency provides these experiences.
Why did you choose this PGY2 Oncology Pharmacy residency?
I chose this PGY2 Oncology Pharmacy residency because you'll have many opportunities to learn about both oncologic and hematological disorders. And I also wanted to work with a larger scope of practice and have a big impact on patients and their families.
What have you enjoyed the most of your PGY2 Oncology Pharmacy residency?
I've enjoyed the most working in the outpatient infusion center because you're able to establish a rapport with both the fellows, the nurses, and the patients. And at the VA, you work with a very supportive group of healthcare providers where they want you to equally succeed as well as providing the best care to our veterans.
What are the application qualifications and requirements for the pharmacy residency programs?
Application qualifications include U.S. citizenship, Doctor of Pharmacy degree from ACPE accredited School of Pharmacy, pharmacist licensure in any of the United States within 90 days of the residency start date, and participation in the National Matching Service and forecast. The PGY2 Oncology residency application qualifications would also include the completion of an ASHP accredited PGY1 pharmacy residency.
What are the core rotations?
The core required rotations for the PGY1 program are primary care, acute care medicine, critical care, and pharmacy operations. Please refer to the PGY1 website for more details. The core required rotations for the PGY2 program include outpatient oncology, hematology and oncology consults, bone marrow transplant, and palliative and hospice care. Please refer to the PGY2 website for more details.
What are the staffing requirements for each residency program?
PGY1 staffing is generally 1 weekend each month plus 1 holiday and provide weekend inpatient pharmacist coverage. Staffing consists of 2 residents working together to perform the clinical and distributive functions of a pharmacist. PGY2 staffing includes half of 1 morning each week for 10 weeks in the inpatient pharmacy for chemotherapy verification and preparation.
Is it possible to speak with a current pharmacy resident?
Of course, please just email the residency program directors and a current resident can directly reach out to you.
What to do in Tucson? Tucson is home to the University of Arizona. If you're into college sports, the university has 21 athletic programs with Wildcats playing many different sports to watch. This mid-sized city offers big city amenities with a smaller town feel. Tucson offers mountains in every direction. You're quite literally surrounded by 5 minor ranges of mountains. With 350 days of sunshine a year, Tucson offers fantastic weather, national parks, forests, and deserts, providing the perfect environment for tons of outdoor activities such as golfing, rock climbing, bird watching, astronomy, and cave exploration. Tucson is a biking paradise. The city has won numerous awards when it comes to biking. You can also find great hiking trails within the city limits. After all the outdoor activities, you'll be happy to know Tucson has a huge variety of restaurants. The various downtown Tucson restaurants each offer unique atmospheres and span the gamut with food choices.
Thank you for watching!